So hello everyone, this is Dr. Humanist again. Let us now discuss about a very interesting topic, that is nanotechnology in medicine or nanomedicine. As we know, it's a very emerging branch which has a very promising applications. Okay, still the trials are going on. We'll see what all possible applications are there of nanotechnology in the field of medicine. Okay, first we'll discuss about drug delivery. Okay, mainly nanoparticles, no, they will go and act on the specific tissue. So, for example, some chemotherapeutic agents we want to use for certain cancer. But as we know, chemotherapeutic agents have lot of side effects. It can affect the normal tissues. But using nanoparticles, nanotechnology, we can deliver the drug directly to the cancer cells. Okay, for example, the doxil for the cancer, like doxil is nothing but doxorubicin, right? Next is diagnostics and imaging, guys. So if you see like biomarkers we use, many biomarkers are there for many multiple diseases. If you think about cancer, suppose ovarian cancer, we use CA125, right? And we can detect that biomarker at early stage, even at low concentration. Other than that, even in imaging like MRI, PET scan, we can use nanoparticles. Right? The nanoparticles will act like a contrast for a specific tissue, and then if you take the imaging MRI or PET scan, it will be more clear image and detailed image, right? So it will act like contrast. Next is in cancer therapy. As I just discussed, it will minimize the side effects related to the chemotherapy, and it enhances the treatment efficacy because it's directly delivering the drug to the cancer tissues. Examples are abraxane, that is albumin bound paclitaxel, and doxil also we just now discussed, and gold nanoshells in photothermal ablation, also photothermal therapy. Directly the nanoparticles will go and deliver the photothermal effect on the cancer cells. Right. Next is tissue engineering also. Right, it will mimic like extracellular matrix of a normal tissues. Okay, so it will provide like scaffold creation, right? It will create a framework, and where the there will be growth of the tissue, for example the bone, right? Bone repair, it will help cell growth and the integration of the tissues, right? It will create a framework where there will be growth of the tissue, right? Next is antimicrobial applications. Okay, for example, for wound dressings, it is been covered with silver nanoparticles, coated. Okay, so wound dressings are coated with silver nanoparticles, which we know silver nanoparticles are has antimicrobial activity, right? One more example is nano coating on the medical devices, guys. Okay, with the same you can use silver particles or zinc oxide or titanium dioxide. They all have antimicrobial, and specifically they'll prevent the colonization and biofilm formation to reduce the, and it will reduce the hospital acquired infection also, right? And reduces the risk of resistance of the antimicrobial agents. Next is cardiovascular diseases, so targeted thrombolysis. Okay, the nanoparticles will deliver the thrombolytic agents directly on the site. Suppose there is a thrombosis or a thromboembolic event. We want to thrombolyze it. Directly the nanoparticles will go and act on that thrombus, reducing the side effects. Also, it can be coated with drug-eluting stents, which will release thrombolytic agents and prevent the rethrombosis in the stents. Right. Next is gene therapy. So gene therapy, it is also an emerging branch where we use a viral vector, like traditional gene therapy. If you see, we'll use adenovirus or lentivirus. Okay, but with using nanotechnology, we can skip this viral vector. That is, non-viral delivery of method can be followed. Okay, like specifically whatever gene we have want to alter, like suppose example cystic fibrosis, CFTR gene, we want to gene addition we want to do directly with use of nanoparticles. We can deliver the siRNA, that is microRNAs or CRISPR components, which will go and edit that gene directly. I mean, we are skipping the vectors here. What are the vectors? Adenovirus, lentivirus, which it has its own side effects like immunological reaction, or converting to disease. So that we are preventing here. So that is how reduces the immune response from the vectors. Next is neurology. As I said, it can cross the blood brain barrier and directly deliver the drug to the specific tissue. That is, we are talking about brain parenchyma, right? So for example, lipid nanoparticles are used for Alzheimer's disease, also dopamine precursors, as I said, in Parkinson's disease, right? So it improves the delivery across the blood brain barrier and targeted treatment to the neurological disorders. Next is last one, nano robots. Okay, so it has precision in performing the medical task, potential for minimally invasive procedures. So for example, there are experimental nanobots for drug delivery and tissue repair. So this is emerging science. Still, there is a lot of research going on. So main concern is safety and toxicity. Still, it is being studied. And next is cost of production. Also, it will be too much, and ethical problem will be there, and long-term safety issues has to be studied yet. So this was a short discussion nanotechnology in the field of medicine, guys. Thank you.